So good morning everybody, welcome. It's my great pleasure to welcome you here in Groningen to this workshop. My name is Alex Dönning. I'm the initiator of this workshop, and I'm also trying to organize money that we can perform on our ideas, which of course you are part of the ideas. So I am also I'm an employee of the University of Groningen. I'm leading the Department of Drug Design. First of all, I would like to thank the sponsors of this meeting. We have 4 different companies which contributed in cash to this workshop, which is very important because this obviously does not belong to the university, so it's costly, and also for the dinner. So, which is Waters, Forte Bio, Nanotemper from Munich, and the rest is taken over by my department. So thank you very much for kindly giving money to sponsor this workshop. Okay, so this is about pharma industry, and this is about early drug discovery. So with this slide I would like to set kind of the background, the stage of what we are trying to do. We can look into early drug discovery from 3 different perspectives. We can look from the pharma company side, we can look from the market side, or we can look from the patient, from the society side. And it's clear that drug discovery remains a complex, slow and expensive, and it's even increasing. The expenses are increasing every year. And it's a quite unreliable process, so the number of new approved drugs per year is constant and pretty much growing. If we look into the process, and the current mostly used process to come to a starting point in early drug discovery is by screening large collections of compounds, high throughput screening. Then we come up with some hits, and from the hits through tedious taking medicinal chemistry, we finally come to a candidate, to a drug candidate which can be evaluated in clinical trials. So this process from high throughput screening to a candidate drug, according to information from industry, typically takes between 4 and 5 years. It's costly, of course, so the numbers which are shown here might be underestimated, between 14 and 25 million to the company. And the attrition rate of the compounds which make it into phase 1 clinical trials is very high, so only less than 50% of the compounds of the initiated projects will make it to phase 1 clinical trials. So, and what also has to be mentioned is that the current libraries which are used in pharma industry are often not very good for so-called post-genomic difficult targets. Difficult targets are non-structured proteins or RNAs or protein-protein interactions. And so this is the perspective of the pharma industry. One type of compounds which pharma likes very much is called blockbuster. A blockbuster is a compound which is bringing $1 billion US dollars or euros per year revenues to the initiator company. And if you divide this 1 billion revenues by the number of days per year, then we come up with something of 2.7 million. So every day a blockbuster is not on the market is a loss of 2.7 million euros. And from the societally view, or from the view of the patients, it is to state that there is only a small fraction of the currently known diseases which can be pharmacologically treated. So in the textbooks you read something like 30,000 different diseases are described, and less than 500 of these can be currently treated. So there is a high unmet medical need. And what is also very clear is that the insurance systems in most of the Western world are less willing to pay for the very high drug prices which are proposed by pharma industry. So if we are now able to cut these first 4 to 5 years of preclinical drug discovery and development to a shorter timeline, so for example, if you are able to cut 50% of the timelines by introducing a new process, then if we look into these numbers here, we can add a lot of additional revenues to the pharma companies. So we can also have a more detailed view into the process of early drug discovery. So we are starting with an initial screen. We are doing a high throughput screening in vitro assays of libraries. Libraries are typically 10 to the power of 6 or more compounds. These are proprietary compound libraries from pharma industry. And this initial screen, which finally leads to a starting point for medicinal chemistry or multiple starting points for medicinal chemistry, is taking more than 1 year or approximately 1 year, and is also, of course, a very expensive undertaking. What follows after this is a so-called is a cyclic improvement by medicinal chemistry of the properties to not only get potency and selectivity, but also to get the corresponding other drug-like properties. And this is called design, make, test, analyze cycle, DMTA cycle. And these DMTA cycles are currently typically performed on 1 to 2 lead series in parallel by one medicinal chemistry group in a big pharma company. And each of these iteration cycles takes 4 to 6 weeks, and multiple of these iteration cycles are needed in order to come up with a drug which can be then tested in phase 1 clinical trials on humans. So it is clear that the improvements in this DMTA paradigm remain incremental, and this is of course because the fundamental underlying process is more or less unchanged since many, many years. There are, of course, newer technologies, and these newer technologies are also a potential competition or an add-on to our proposal here, which is DEL, DNA-encoded libraries, or fragment-based drug discovery. So what we are proposing today, and this is why we are gathering here, we want to speed up chemistry. We want really get chemistry to speed. We want to make a very tight connection between chemistry and biology. And we want to use artificial intelligence methods in order to come up with a more efficient drug discovery cycle. So this is the aim of today from a scientific or technological standpoint of view, what we want to convince you. And we call this drug discovery at the speed of sound. Speed of sound and not speed of light, as Edward was mentioning in the morning. We are not yet speed of light, we are still in the area of speed of sound. So with, like with all good food, there are secret sauces needed, there are special ingredients needed, and so this is the secret sauce which is giving the taste to this meat dish here. And in our case we have multiple different secret sauces, and in this introductory talk I want to introduce you to our secret sauce. So this is a pictorial overview of what we want to propose here, how this technology platform, drug discovery at the speed of sound should look like. So we are synthesizing in very small quantities very large and diverse libraries, which is called the instant chemistry. We are combining this on the fly with screening methods which have a similar speed as the chemistry. And a major tool which we are using here is acoustic dispensing, because acoustic dispensing allows us to synthesize and to screen compounds very rapidly in very, very small volumes. And this is not just about synthesizing and screening compounds in phenotypical assays and in biophysical assays, but it's also a method which should allow hit-to-lead expansions or the optimization of the initially found hits. And this is driven by artificial intelligence, and what we are using in our group is genetic algorithm. And we have the add-on that we also can do high-throughput crystallography, and Matthew Gross will give a talk later on high-throughput crystallography, how it can be built in this system and give structure-based information in order to come up with, or in order to guide the interlead generation. So one of the secret ingredients is shown here. It's precise and fast dispensing of super small volumes. And this is done by a technology which is called acoustic dispensing. And we are very happy that we have the market leader on board in this consortium, which is LabSite, and from South San Francisco, and a group of people from LabSite who are joining today. And the second talk after me will be by Richard Carlson, which is one of the founders of LabSite, and he will detail the technology of acoustic dispensing and how it fits into our idea of drug discovery at the speed of sound. The second secret source which we are using in our technology platform is a very large and relevant chemical space. So these are 15 or so different compounds which are coming from different types of chemistries, different types of scaffolds. They are all, according to industry standards, what they are calling drug-like, meaning they are obeying certain types of rules. They have a certain likelihood of penetrating into the CNS, which is very important for some type of diseases. And this chemical space is something which we are really bringing in from my group, from the University of Groningen. This is where we are specialists in. So this is our knowledge. We have a database of more than 1,000 different scaffolds, which we can do in a very fast and reliable manner. And the chemical space behind these different types of scaffolds is billions and millions of different compounds. So if we are, we are intending to do chemical synthesis on miniaturized plates in very high density, in very high diversity, at very low volumes, or nanoliter, low microliter volumes. And this kind of miniaturization of the chemistry should lead to a dramatic acceleration of early drug discovery as well. So what we see here is a 1536 well plate, which is divided up into different areas, and in each of these areas we are doing different type of chemistries, and these type of chemistries are done in parallel. Okay, so we do on one plate 96 different chemistries, multi-component reaction chemistry, one-pot chemistries, and in each of these small areas you see 16 different representatives of this particular scaffold. And in the future we are also intending to go to higher densities like these 3, 4, 5 plates. And we will have different talks. So this is a technical talk from Dr. Shavani. She's showing some of the projects we recently commented or started in my group on using an acoustic dispensing machine. Later on there will be Michael Kostenjans from AstraZeneca in Sweden. He will introduce the iLab platform, and then there will be Konstantinos Neokuritis from a local biotech company who will talk about the chemical space of multi-component reaction chemistry, that you get a better insight what type of scaffolds we are talking about, what kind of chemistry is possible in this very dense format. And in the afternoon there will be Ova from the University of Leiden, who will talk a mix of different things, but he will also talk about chemistry using acoustic dispensing the Leiden experience. The next ingredient in our technology platform is screening, high throughput screening. The high throughput screening, of course, in order to have very short cycle times, must be compatible in time-wise with the chemistry. So it should be possible to screen multiple hundreds or even thousands of compounds per day. It should be either using biophysical methods or even phenotypical methods, and later on we will see one example from the collaboration between Waters and AstraZeneca, which can be used for which is mass-based screening, which can be used for affinity screening or even quality control of the synthesis of the compounds. Another method is sulfur plasma resonance based, and we will have multiple different screening methods which are compatible with our system, which will be shown today. And especially interesting is also that we are trying to involve phenotypical screen, and there will be a talk in the afternoon how to use patch clamp methods of on cells for this kind of approach. The last ingredient for our technology platform is artificial intelligence. So in order to have very short cycle times, we are proposing to have the hit-to-lead progression driven by genetic algorithms. Genetic algorithms are a subclass of artificial intelligence, and they allow for optimizing complex multidimensional problems. And we have worked on this and published on this in the past. Genetic algorithms are in a way close to the evolutionary process which we can see in nature, and of course we can compare nature's evolution with the drug evolution using genetic algorithms, and then we can find the parallel, or we can define the parallels. So for example, if you're talking about in nature or genes, then we mean in chemistry, these are the building blocks for assembling different types of scaffolds, but the genes can also be the reactions. So if you have a reaction which is used to assemble a certain type of scaffold, this is also what we call a gene. The fitness is given by the screening against our physical-chemical screening process or other type of screening processes. The selection is based on the quantity, on the number we are getting in the affinity screen or in the phenotypic screen, and the evolution is based on the rules of genetics, which are replication, crossover, and mutation. And we can perform similar things in chemistry. So if you are talking about evolution in chemistry in a genetic algorithm, then we mean, for example, variation of the building blocks, variation of the different reactions, variations of the different scaffolds. So already 20 years ago, in my first lab, in my first SAR company in Morphochem, we were using genetic algorithms in order to drive hit-to-lead expansion. And this is a very early publication from 1995 in Angewandte Chemie, optimization of the biological activity of combinatorial compound libraries by a genetic algorithm. So what we did basically here on the y-axis, we see the EC50 against an enzyme, factor 10A, and we were starting in the first generation with millimolar inhibitors, and we could show that driven by genetic algorithms, after 16 to 20 generation, we were reaching a plateau, a minimum, which were sub-micromolar inhibitors for this factor 10A in this case. And the typical size of the generation was 20 compounds, so 20 compounds per generation, and you see how the generation, the average IC50s of the generation are improving from generation to generation. So if you make the calculation, then we can see that we are coming to a minimum after 20 different cycles. And we performed 20 different syntheses per generation. So if you do the math behind it, and with 400 compounds, we were able to screen a very, very large chemical space of hundreds of millions of different compounds, because this was MCR chemistry, and we were reaching a minimum. So this is very important to note, that synthesizing and testing of a small fraction of the chemicals is sufficient to come up with good compounds. And we have done this again and again and again for many, many different targets in the biotech company Morphichem, which of course is not published. So this is one of the old data. Here we have the IC50s of two different types of serine proteases. So this is generation 0, and this is how you see how the generations are evolving, and the IC50s are coming closer to reasonable values. And after a couple of generations, you can see, since we did not put any selection pressure, that we get rather unselective compounds, which are inhibitors of protease A and B. However, if we are putting a selection pressure on our genetic algorithm, on our evolution, then in fact we can do compounds which are selective against protease A or protease B, but that means also that we can use the genetic algorithm in order to optimize compounds not only against the target and for selectivity, but we can also introduce, for example, other type of features like stability or penetration in form of a compound or something like this. So we can optimize against multiple things at the same time. So to summarize this technology platform, drug discovery at the speed of sound, we want to introduce and we want to build in order to dramatically fasten up early drug discovery. And the ingredients are again shown here. We have a very fast and diverse chemistry, which is producing compounds on the fly in very, very low volumes. And we predict that we can easily synthesize 10,000 compounds per day on nanoliter volumes with very high scaffold diversity. So we are talking about a scaffold diversity of more than 1,000 different chemical scaffolds. And of course, these are not mixtures, these are one compound per well. And this is combined with a very efficient on-the-fly screening of the synthesized libraries, for example, by mass spectrometry, by SPR, or other different techniques which we see today. And these drug discovery and optimization cycles are evolved, lead-to-lead expansions evolved using artificial intelligence, and we are specialists in genetic algorithms. And we predict that we can run a cycle per day, or maybe even in the future several cycles per day, which will lead us from millimolar inhibitors to improved compounds, nanomolar inhibitors, picomolar inhibitors in a very short time. And of course, these compounds are not fully optimized, as all the bad chemists in this room know. So there's additional work which has to come afterwards. But at least some part of the early drug discovery is fastened up, and the other benefit of these approaches, of course, that we are getting multiple scaffolds, which are good starting points to fine-tune the properties of the compounds. And the additional benefit from this machinery is, of course, I mean, there are very many question marks we can discuss in the discussion afterwards, is that any of these compounds, since it's one-step synthesis, since all the building blocks are shelved and present in the lab, can be resynthesized from the nano mole scale to a mole scale, multi-milligram, and can be highly purified by HPLC and can be validated. And also, of course, the option that we can introduce high-throughput crystallography, which we will see later on. So, so far the introduction of the concept per se. Just give me 2 more minutes. I want to focus you on the outcome of the day. So why are we assembling here? We are not just coming together because we like this topic, but there's a certain reason. So we want to win this perspective grant, which is a public-private partnership grant, a very big one from the Netherlands, and we need your input. we needed to form a consortium that we are winning and can build this technology platform. And so far, the consortium, the WAC consortium looks like this. So since this is a Dutch grant, public-private partnership, so let's start with the public partners. This is TU Eindhoven, this is University of Leiden, and the Rijksuniversity of Groningen. All the three partners, of course, in Netherlands, and then we have big pharma partners which showed initial interest, which is AstraZeneca, which is Leo Pharma, which is Sanofi, and a small local biotech company, Telesis Pharma. And then we have two beam lines which are highly interested in this project, which is Diamond in UK and Daisy in Hamburg. And last but not least, we have a couple of very important ingredients, which of course are our instrumentation companies, LabSite from Silicon Valley, Waters, FortiBio, Nanotemper, Nanion from Munich. And we have a couple of visitors here from big pharma company, and maybe we can also in the future, in the next future, convince them that they are joining this consortium. So I think in this perspective grant we have pretty good chances to be on the winning side. The areas which are covered in this perspective grant are computational, chemistry, water, energy, and so on and so on. So 9 different top sector areas which should lead to a growth of economy in Netherlands. And we are, from the 50 grants which have been submitted so far, we are the only one which cover chemistry, and we are the only one which cover chemistry and life science and health. So we cover 2 of the very important 9 top sectors, and our grant is the only one which is covering these 2 areas. So already from this and from the huge interest of the private sector, I think we have reasonably good chances to win the money. So the aims of the perspectives of the perspective grants are shown here: development of scientific excellence and new technology. This is relevant for business and society and multidisciplinary approaches, building intensive and sustainable collaborative relationships in between the consortia with multiple knowledge institutions. So this is the public part, and the companies and the social organizations, creation of more focus and mass coherence and research and thematic areas relevant to Netherlands. Promoting the valorization is very important of the development knowledge by society, social organizations and the end users. So coming to the numbers, this is very important to know. The maximum co-funding of the NWO, which is the Dutch funding organization per grant, is 4 million euros. And these 4 million euros need committed industrial partners, the so-called users, and they have to give 50% in cash and 50% in kind co-payment, which adds up to 600k in cash and 600k in co-payment. So this is very, very important. Without these co-payments and without having the different partners which are here today and which we are still looking for, there is no chance to get the grant. The timeline, so this is a 3-phase grant proposal. The first one was November 7th, which was an initial one-pager teaser of what we want to do. So we are now in phase 2. Where we already have submitted a 10-page proposal with a vague description of the consortium and some supporting letters which show that there is really interest from industry. And we are now waiting for the referee's comments, which will be in the middle of February, and then we have time to May 17th to come up with the final proposal, which also needs the signatures and the really commitments, hard commitments of the pharma partners and the instrumentation companies and the consortium partners to be part of this undertaking. So this is what we want to accomplish today, and always bear this in mind if you see the wonderful other presentations of all the other people. Thank you very much. So the idea is always 25 minutes of presentation and then 5 minutes of discussions if you want to discuss something immediately. If not, then we will continue with Richard Elson.
Thank you, Professor Dahling, for the introduction. I don't usually get asked to speak about revolutions. I don't think I ever envisioned I would be a revolutionary. When we started out working in this area back in the year 2000, we didn't really know how much trouble we would cause. I think most of it's been constructive trouble to date. So I'm going to talk a bit about the history of how we came about technology. It's a bit odd, moving liquids without touching them by using sound. And then how we've extended that to a large number of different areas. And I think what we're seeing now is that there's a confluence of a lot of technologies, analytical technologies, chemical technologies, and acoustic technology coming together that can actually form another revolution. So really my goal today is to get all of you sort of on board with how we've used this tool, this instrument, to facilitate these revolutions in different areas, and to get you thinking about how you might use this tool in the future. Because our job is as tool makers, we generally don't go out and do applications, we don't find drugs, but we do want to go figure out what it is that you need to be more successful with your mission. And to really build relationships today to find out, as you start using the technology, and you'll hear about some people who are also helping us with the tool side, hear from Waters, but also people are now starting to dip their toe in the water or in the solvent doing this kind of work. What is it that they need next? And that's really why we're here, because most of our success, and I'll share that with you, has been listening to customers about, you know, the instrument does this, but what I really need is this. And that's been a large part of our success in the revolution. It's really listening to the people out there in the field who are doing work and then figuring out what's the next advancement that we can put out in the instrument to help you do your work better. And I think because this is complicated, there's lots of components that all need to work well. It really takes a lot of listening, no pun intended, to make sure that we hear from you what it is that you need and we actually go out and make it happen. And it's been a journey to get here. It's pretty exciting. The conversations that we had in the early days about doing this kind of work, which date back about 10 years ago, it was basically Joe, myself, and one other person that were involved. And now it's great to see a room full of people who are interested in moving these kinds of things forward, because the best revolutions are one where you have numbers on your side. So thank you all for coming today. So I'm very quickly going to take you through whole centuries in just a minute or two to give you some background on where all this technology came from. Talk about what we've done in changing the way that drug discovery is done in a narrow segment of drug discovery, which is mostly around the once we formed, working with chemical libraries and how we expanded that out into assays and also into some of the back end of crystallography. And really show you that process for, okay, now we have a new technology, what are we going to do with it? What problems do you solve? And really what were the big advantages of implementing the technology and changing people's workflow? You get your minds thinking, well, what might you do with it? Sometimes it's not what you think it is. Because usually the use of the echo isn't just because it has a small drop to make something smaller. It often leads to a completely different way of doing something that is an outgrowth or an outcome of it being small. And we'll talk through a couple of things that we've experienced. Again, mostly from customers. Oddly enough, a lot of them have come from AstraZeneca. When I went back to start looking at some of the novelties in our workflows, they're one of the major contributors. But they really come from a lot of different companies throughout the years in changing things. And then really talk to how to continue that revolution and integrate things that we have today and also on the back end, and you'll hear more about that as well from Waters. So I won't go into too much detail on the analysis part, because I'll leave that for Ed later today. But certainly if you have questions on how our front end works, you can catch me later on. But I won't go into detail on some of the existing work on the assay side or on the desolvation and other mechanics aspects. But we actually owe a lot of our history to chemists. So the partner in Loomis actually was Robert Wood, who some of you might know as a chemist and spectroscopist from nearly a century ago. They actually were the first people to notice that you could move liquids with sound. So I think they both had children and realized they couldn't really move their children with sound, so they decided to try liquids. And this actually worked almost as chaotically as their in-suite kids, but it was easier to visualize. So they actually took big sound generators, put them in oil, and basically created a small volcano. So, pipettes are actually better than this. So this was not a good implementation of moving liquids with sound. Certainly you couldn't dispense anything accurately, but it was interesting to watch. There were efforts many decades later to turn this into more of a control process and to have a stream by focusing the sound energy. So in this case, they really didn't focus it quite precisely, but they made enough of a concentration that they could make a mist. And so people actually made commercial vaporizers or nebulizers that were used for inhaling drugs. So the first drug dispensing actually was for inhalers with acoustic. But again, very difficult to control the doses even the time, because it would change with materials, things would get out of the concentration zone and they would change. But if you basically poured in stuff, you could vaporize it and you could inhale it and you could get the dosage that you want. It's not necessarily been fixed. When things got more sophisticated, people looked at this as a printing technology. So IBM started to do that in the 70s, where they actually took the energy and they actually had a real lens with a real focal zone. And they tried to pin the liquid at a little, at an orifice, at a hole in an aperture plate, focus the energy and inject the sound. So this is really the first effort to make a sort of a drop on demand, much like you would get with your pipette tip. You pull out fluid, you move it over, you drop it down. They tried to do the same thing acoustically by adding in this controlled focus. The problem was that as soon as you started ejecting material out, it could actually leave that focal zone unless you replenished it. So they would constantly have to flow into material to replace the things that left. And of course, if you have an inkjet printer, if you let it sit there for a long time, things could evaporate the solid and leave, and those things could clog. So it still had the disadvantages of pipette tips, although it had the acoustics as a motor force. Other companies started looking at ways to make this into a more robust printing technology, including recognition equipment industries, which is now defunct, and also Xerox, which is another printing company. And they introduced the idea too that if I could take lots of different types of materials, say cyan, magenta, yellow, black, ink, put them in little valves, run them over a belt, I could then actually make this into a color printing technology. So they made efforts to do that, but again they had a problem that every time they would eject things out, after a while the sound energy would go out of focus as the liquid was depleted. So these were not very effective methods because it was hard to reflow things. In this case, they would reapply ink through rollers and complicated systems. So none of these things actually were commercialized. Just the way that inkjet printing technologies using piezo and also thermal inkjet basically overshadowed these technologies. But back in 2000, one of the things that we realized is, this actually might be more useful if we could add in some intelligence to the system, so we could use the acoustics not just as a motive force to eject the liquid, but what if we could use it to figure out what the liquid was? We could actually make something that was smart enough to do with multiple liquids. We could actually adjust the focus so that we could use a lot of the liquid rather than just what was in the narrow focal zone. And we could also control drop size. By having a conversation with the material acoustically, we could fix all that. And that was really the origin of the company, but you try to get away from pipettes, which you can't really talk to. You can't really ask a pipette, are you clogged very easily? Or adjust the pipette dynamically. You have to give the information you need to transfer. So we said, what if we can actually set up a facility where we can do all the inquiries that we need with sound and do that? And we actually, like many Silicon Valley companies, move the car out of the garage and actually set up a laboratory there to start working with this. Of course, we had to be very careful what solvents we use. So all of our original experiments were all done in water. But one of my co-founders, she cleared out her garage after we developed the company, sort of developed around my kitchen table. But we didn't have enough room in the garage. She agreed to move her Mercedes out, which is the driveway. The company did buy her a car cover, but we got the garage space. We had to share it with her dogs. So it wasn't really the cleanest environment for chemical synthesis, but it was enough to make sure that we got money. We brought in people with money and said, we know this is crazy. You probably don't think it works, but we won't ask you to give any money until you see it. After you see it, if you don't want to give us money, we won't bother you anymore. So it really didn't take very long to get people to believe by showing them some video and actually letting them come into the garage to see that the phenomenon works, so we could get some real facilities and start doing the chemistry. So the intelligence that we had to add to make it work, to really start to power the revolution, was really bringing in algorithms that allowed us to process what was going on with liquids. So in particular, we had to use what's used in submarines. One of our other co-founders actually was a naval officer who worked aboard nuclear submarines, so he was a sonar officer for some time. He said, well, we could always figure out what the liquid is just the same way bats, submarines, and dolphins do. We can send out sonar pulses to listen and come back. So we solved the first problem, which was basically we could launch the sound wave up into the liquid. We could listen to when it came back down, right, so we'd know where it was. We could make sure that we were in focus, not just at the top, but anywhere. And we could then concentrate the energy like had been done previously in these other technologies and shoot those droplets out. The next big challenge was to make sure we could work with the microplates. So we developed sort of the equivalent of the acoustic optics to allow us to focus the sound energy deeper into the well. So we could actually work with tall containers that are typical conveyance for materials that are used in the laboratory. And by moving the transducer up and down, we could always maintain focus throughout that range. So this involved a fair amount of physics work, which we've recently published. If you're interested, we can send you those references. The physics is interesting, but in terms of the acoustic side, but we also entered a new realm of physics where, for the most part, you don't take test tubes and turn them upside down unless you plan on making a mess. But we also entered a domain where now the drops were so small, because we didn't worry about clogging, that you could do your work upside down. And this really was quite revolutionary. The idea that surface tension was now more powerful than gravity. And the implications of that are actually somewhat profound when you start thinking about the forces that even you worry about as chemists and the things that you need to accomplish like this. So we've entered a different domain here as well in terms of solids, where surface tension is now more powerful. And I'll show you what that meant to some of our customers. So again, as I mentioned before, we could work with, for some reason, the gray doesn't show up here. There actually are walls. We're not doing containerless processing. There's walls for some reason that don't show up in your projector here. There's supposed to be a little well over here. It shows up on my screen there, not here for some reason. So again, using the sonar, we were able to keep focus at all times. So even as we replenished the liquid, or if it was a volatile material that was evaporating, we could maintain focus. So we could basically have a large working volume for the well, unlike the previous technologies. And then we also brought in another technology, which was medical ultrasound. So as you know, if you went in to get an ultrasound scan, people could detect changes in the tissue because of changes in the acoustic density or acoustic impedance as it's known. We could do the same thing and essentially build up ultrasound scans, but doing them at the small scale. So we do ultrasonic scans of the well. And since we knew what the plastic was, it was essentially our acoustic phantom, our calibration standard, we could extrapolate the properties of the well. So it turned out for the solvent of greatest interest for people in chemical libraries, when you start adding water into DMSO, as probably you know, you change the chemical, or you change the rheological properties of that solvent. So you add in water to DMSO, you change its surface tension, and you make a very significant change in its viscosity, which can be troublesome, right, if you're trying to dispense something to do it accurately, if you don't know what its viscosity is. So it turned out by measuring the acoustic impedance, which is also monotonic with the amount of water that you added to the DMSO, we can basically adjust dynamically the acoustic parameters to make sure that we always shut out exactly the same volume of solvent, irrespective of what the material was. So this fundamental physics solved all the problems that we'd set out to do before we ended up getting equipment there in the garage. So we then raised enough capital to go and build an instrument. And even though there were computers back in the year 2002, people still built things out of foam cores, and they were actually making big mock-ups after they did their computer design and trying to figure out how am I going to put all the components that I need in this revolutionary instrument into a box. And eventually those things were skinned out into the instrument, the Echo, which was introduced back in 2002. Actually, it turns out it was in the Netherlands, just up at The Hague. In 2002, we announced that we would make an instrument on the show. A lot of the people who became our first customers were at that show. They actually thought we were a bit crazy. They didn't understand that this revolution, I think, was a real revolution because they hadn't been to the garage to see it actually run. So when I was up on the stage at The Hague, I said, okay, here's this technology, sounds a bit crazy. Next year we'll show you how it works. We'll bring an instrument to the next show, which was back in the US in Portland. And that's what we did. And actually our VP for RD, who's still at the company now since 14 years ago, here running around getting everything set up to demonstrate the instrument. We did run the instrument live, dispensing 2.5 nanometer droplets for the duration of the show, and it ran quite well. The next thing was to roll it all out, make sure our investors were happy, and actually get revenue. So we started shipping instruments a bit later to both AstraZeneca, actually BMS, were amongst our first customers, and the first instrument came over to Europe in Novartis in Impossible, and they did a lot of the development. The initial instruments were for 384 plates, and then Impossible had the first 1536, using that as a source plate. And then we were fully commercial in 2004, again shipping a twin pair of instruments off to BMS, which, as our CEO likes to point out, unfortunately are still running after 14 years. Those instruments are still in service. Needless to say, I decided to celebrate with other kind of liquid dispensing. That was a pretty happy guy. So what did we do to drug discovery? Well, again, it wasn't just about making things small. It wasn't just that we had a little tiny droplet that's maybe 1/100th of what you could dispense previously. It really changed people's workflows. And amongst those new customers, we learned quite a few things. And I'll share you two major categories. One, that miniaturization changed what they did, not just the size, but the workflow. And also that upside down meant that they could do certain things a bit differently, and it changed again the work process. And in particular, it led to different kinds of mixing behaviors. So probably the first thing that came from customers was Bristol Myers Squibb. They traditionally, and probably many of you might have done this yourselves in the past, without an echo, you would basically do an intermediate dilution. If you wanted to take things from your sample store concentration, you would create an intermediate plate. You'd use those plastic things, what do they call those? Pipettes. You'd, sort of gross, but people would actually dip pipette tips into their liquids. They'd pick up their solvents, they drop them in another plate, they dilute that out, and then they do it again, because that was the only way to accurately get the dilutions that they wanted. Again, with the acoustics, the drop was so small, they could eliminate the whole intermediate process, get rid of all that plastic, and just go directly to the source flow. So this was a big cost savings for BMS, and they were quite pleased to be able to implement this in their systems. The other big innovation was, well, you know, I could actually do IC50, so that solved a lot of their primary screening problems. So then they said, well, can we do the same thing with secondary screening? So this actually came from AstraZeneca. This is work done at the now closed Wilmington site by Dylan Nee. He said, you know, I could actually do IC50s. I could do it with direct dilution, but I don't have enough range because I can't tolerate that much TMSO. I can't put in 1,000,000 drops in one drop, right, to get 6 logs. What I can do is I can do 2 dilutions. I can do a large step zero dilution, and then I can fill in the holes. So the first dilution then would be to do maybe 100 to 1, and then you could follow up with 1, 3, 10, and 30 drops of each one of those. So you pre-make the mixture, and then you could basically, by changing the number of droplets, you know, you could basically do all the kinds of half-log plots that you wanted to do for your IC50s extremely efficiently. And if you do the math, this turns out to be the most efficient way to create dilutions. You could even pre-store your large step cereals. So it's very, very accurate and has been adopted by a lot of our pharma customers as the methodology. Again, something that you couldn't do unless you had a very small drop to make very small increments to get your work done. So again, something that came from customers. We've since made this easy to do and automated in our automation systems with essentially a dose response software that allows us to be heavily automated. So you just basically say, here's the letter that I want to make, and then it would take care of all the dispensing and decide where to put all the compounds in the wells. So next I want to talk a bit about gravity. So one of the problems that was actually visualized at Novartis when they started working with very small wells, they realized it was actually somewhat difficult to mix 1536. But they decided, you know, we're going to go and actually visualize what happens if we, again, for some reason the color's not there, so there should be a blue solvent here where this DMSO drop is now entering. And when that drop enters, it actually can sink down to the bottom, which maybe you can just barely make out. Sorry, this light intensity is just too bright, it's washing it out. So essentially the DMSO, because it's denser than the surrounding buffer, can fall down to the bottom and spread out on cells. And this effect can be quite devastating for cells. But what happens when you turn things upside down, it's still very difficult to see. Sorry, I don't have to make these darker for the next presentation. But if you turn this process upside down, you can make all this go away because you reverse gravity. So a lot of these visualizations in the early days really tried to show what was going on because people were seeing unusual behaviors. And in fact, a lot of times we hear about arguments between medicinal chemists about what should happen and what was really occurring in screening. So we constantly came across these kinds of missions. And this one, I think, was the first one that was well visualized. But what happened when you did things acoustically is you could shoot the drops, which you can see here in the video. But now you've flipped around gravity. So you're now taking the dense thing, the DMSO, and you're shooting it into the lighter, the less dense material, which in this case is aqueous buffer. So it doesn't go anywhere. Now gravity's on your side. but more importantly, because the buoyancy force, right, that gravity force doesn't pull the DMSO before it makes things drop to the bottom of the rock. It actually allows it to spread out along the surface with surface tension forces and then take over and have gravity take over. So you get a more diffuse flow of material. So again, things were smaller and frequently they were better. And so people had to adjust to that. Similarly, there were some things that they used to do that were large. Again, this was at AstraZeneca. They wanted to do cell-based assays and to send the drug in, and they wanted to do these sometimes for ADME in 96 wells, so they had a representative cell population. So the initial experiments, they were actually not very successful because, of course, if you take things with 40 microliters and more and turn them upside down, they fall out. So the surface tension isn't powerful enough to hold that. But what they found was that they could actually do a media change. So if they took the media out and reduced the volume to about 30 microliters, they could invert it. But if they shot the material into the middle, they still had the same effect they had when the DMSO dropped to the bottom, because it was just too close. So it diffused directly in, and they get a big hole because of the exposure to the DMSO or potentially much more toxic concentration of the compound. So in fact, with the acoustics, because they could target the drops very well, they would just send them in off-center, and they would essentially get the same effect you saw before. If they put it up in the meniscus, surface tension would wrap it around, and they could get the drug compound to come down diffusely when they flipped it later. So again, a lot of times things were just different, and they had to be adapted to make them work. And frequently, you could find that that physics could be used to your advantage to get you to a much higher quality level. So the next big mystery was, how do we expand outside of just working with DMSO? Again, because the two pieces of physics we implemented, sonar and medical ultrasound, they were amenable to figuring out what was going on in the bulk properties. As the sound traveled through, bounced off the liquid meniscus, and came back down, we could hear things. But some things don't happen in the bulk, they only happen at the surface. And as you know, surfactants, being appropriately named surfactant, similar to that surface word, they really only happen at the surface. And the only way to find out what's going on with the surface was actually to measure the surface explicitly. So one thing we found when we didn't know what the surfactant concentration was, we're trying to make a drop, especially as the drops get smaller and smaller, more and more of the energy of the formation of the drop isn't just in a kinetic energy, it's actually in creating the new surface. So you needed to know accurately that surface energy. And of course, this became increasingly important the smaller you got. So ideally, you'd always want to have just enough power to pull one drop off the surface, but if there was more surfactant in than you thought, you could end up in a situation where the surface was too loose and you could actually create more than one drop or a much bigger drop. Similarly, if you thought there would be surfactant in there and there was none, the surface tension would be strong enough that it could actually pull the drop back down and you'd get nothing. So the technologies that we originally rolled out from the garage weren't adequate to deal with this. They were all bulk property measurements. So we needed a way to basically figure out what's going on with the surface, but of course we couldn't make a mess. We didn't want to reject something by accident and put a drop where we didn't want it to go or at the volume. So we had to come up with a method to do that. And again, we always tried to rely on our friend, which was acoustics, to see if we could do it acoustically. So what we would do is we would put in a pulse that was small enough to not make any droplet come out, no matter what the surface tension was. And we'd create a small mound. And while that mound was formed, we would then take another sound pulse and we'd bump it off the mound. By listening to the sound that came back from that surface, it sounded rather different. You can imagine sort of the interference pattern experiments you might have done at university. You essentially get acoustic wave interference bouncing off of this small perturbation. And you can see when it comes back, there's a lot more overlap in those waves. So we did a lot of fancy signal processing to basically convert that into a measurement which can then be correlated with how much more we need to raise the power to do this work. So pretty obtuse physics, to be sure, but the chemistry implications were tremendous and what we could work with, because now basically we didn't have to care about surface tension. Similarly, all the other things that changed in materials when you use them that could have an impact on acoustic power, the scattering of particles, the attenuation of sound, viscosity, all the other forces could basically be rolled up into, if I can't get enough power to the surface to make a mound, to make a drop, I can figure out how to turn it up. So basically, you can start working with things initially that were surfactants, but then, which enabled us to move into the whole sort of genomics area, where of course lysis buffers are common, and sort of the unknown quantity of lysates was pretty a pretty constant problem. We were we didn't know what the surface tension was with it or well. But once they had that, they realized we can actually now miniaturize all of our preps to do a whole bunch of different processes. We'll just talk about one briefly for NGS, where there was a major reorganization of their workflow. Typically, they would normalize concentrations, dry things down, rehydrate them at a different concentration, and pool them together because they needed to pool lots of different materials into one well. So this is a pretty complicated process, somewhat reminiscent of the earlier work done at BMS with the intermediate things, but actually even more complicated because it involved 2 intermediate steps. And now because they were small, they could basically do the whole thing. Because we had a small drop with a small volume, they could basically determine that concentration in the same way they did previously, but rather than going through a complicated normalization step, they could just normalize the amount of material that they transferred by changing the number of drops. Because the drop was so small, if you had a low concentration, you use a large number of drops, you had a small concentration, smaller, but they were also small that you could pool them all in one small container. So this, again, was a huge simplification of the workflows and the amount of labor and consumables that allowed people to not just end up with everything pooled in a container, but even in a smaller container. And this was something that caught on very quickly within large screening centers because they just saved so much material. And in some cases, it reduced the cost of reagents by 99%. So literally a 100 to 1 reduction by eliminating all these intermediate steps. So again, it wasn't just the miniaturization, it's what it meant to the workflow and the simplicity. So that was just by adjusting to surface tension by itself. As I mentioned before, you could also now compensate for other properties like viscosity if you allowed the power to be changed by even larger increments that exceeded that which you would just get with surfactant changes. And that allowed us to move up to extremely viscous materials. So our first target action was to sort of tackle protein crystallography. For those of you who've done crystallography work, you know that the reagents can be quite tricky. Frequently you have to calibrate every single reagent differently or in multiple classes to deal with things that were viscous or not. So our challenge was to basically come up with a calibration, which was launched in our version 2.4 software, which was smart enough that you could give it a protein crystallography set and blind, right? So it would only use acoustics to figure out what was going on with every well, and it would transfer the entire crystallography set without flaw. And that's been used in a lot of the major centers. In fact, Diamond, I think, just purchased their second instrument to do crystallography setup. And actually, one of the authors on this paper, Alan Orville, who's now was originally at Brookhaven, they worked with us originally to not only show that the acoustics was gentle enough to move crystals. In fact, Alan was probably the biggest non-believer. He told the guy, Alex Soros, who's the last author here, that he didn't think that you could move crystals acoustically because they would break. And he said the probability that we would be successful in doing that transfer was exactly 0. But he let Alex come out to our labs and they actually ran the crystals. They put them up on the beamline back at Brookhaven. Of course, they transferred just fine. Alan said, okay, I was wrong, I'll be the PI. So he's raised a lot of money for them to do a lot of experiments, including this one, which again showed how you could change workflow. They realized we can now make crystal slurries. So we can make the crystal slurry, we can figure out what the slurry components are with the echo, make the slurries, we can transfer the slurries to small paddles, and then we wouldn't co-crystallize ligands or the fragments. We could actually put the drugs right on the crystals because again, they were so small that you could put the drugs on them and they would diffuse into the crystal without them shattering. So they basically came up with a whole new workflow that allowed them to do one crystallization experiment, but then screen ligands, small molecules, or fragments, and actually get good results and throw those up on the blue line. So again, a new workflow that came out of the fact that the physics was different because they were small. So it wasn't just miniaturization, changing material, it was a new workflow. So we've seen similar effects with people then trying to do combination screens to do combinations for drugs. And a lot of that was pioneered again. AstraZeneca, this was some material from Eric Tang, where he originally started taking multiple things, putting them in one well for combination drug effects. So there's a lot of stuff that's been done. I've only touched on a couple things to give you a flavor. There was a journal that was actually edited by Joe and 2 of our colleagues from who've been long-time acoustic users that sort of summarizes a lot of the applications that have been part of this revolution. And of course, that sort of added on to the nearly 800 peer-reviewed publications and other publications that are out on the subject. So now how are we going to move this into the chemical synthesis space? So again, as I mentioned before, this has been a long-standing conversation that Joe and I have had, in particular with Tom Vega, who actually came in our labs to do some of the preliminary experiments and share vision, a lot of which now seems to be crystallizing, pun intended, with this group today. So literally, these are his slides unchanged from 10 years ago. So he basically wanted to have his model, very similar to what you've heard today, and you'll hear more about it today, by doing synthesis with MCR and OPS, and having these materials be available on the screen to do the measurements and actually take these up and do crystallography. The problem we had with Tom was back when he was doing this was before that version 2.4 software. The only choice he could use for all his work was the MSO. And he did some of that preliminary work with the MSO, essentially the kind of thing you're going to see from people today. Synthesize, screen, and then go off and determine structure, again using libraries that are set up for those fragment materials. So you'll hear more details on, basically, but the workflow that he had envisioned back 10 years ago is sort of what the consortium is trying to fulfill today. Of course, we handicapped Tom to only work with the MSO, but he was successful in showing that drug-like molecules could be formed with the echo and that he could miniaturize things accordingly. So what we weren't able to do back for Tom was to actually give him a full system that allowed him to do this in an automated environment. His vision 10 years ago was to basically do the synthesis, to do the analysis, in this case with UPLCMS, and also to do screening all over the platform. And this is now something that will come to be. So just 2 more slides and we're all set. So basically we had small droplets, we had a broad range of solvents, we could do drop-on-drop, crystallography and other things, and we could do synthesis Tom proved out in very small volumes. But what did we not have? We didn't expand everything to make sure that no matter what solvent you might use for chemistry, that those drops would land on each other. There's lots of technical issues that we have to still resolve to get the calibrations to be smart enough to make sure the placement is good. Probably not something that won't work, just not something that we've done. And also to make sure that the instruments were capable of handling the kinds of reagents of interest to this group that are typically more volatile than TMSO. But the other big thing was we now, and one of the frustrations Tom had was even if he made really small amounts of material back 10 years ago, he couldn't figure out if they were correct because we couldn't validate them. And Ed will tell you more about the work that we've done to do the acoustic MS to try to bring these into better alignment. So if we make small samples, we can validate small samples. And actually to do them at the same kind of speed. We've been able to now transfer things. Typically, echoes could go 5 to 10 different materials per second. So if you have 3 or 4 components in your multi-component reaction, you can assemble things, at the per second level. But even the fastest analysis methods for an order of magnitude slower. So that's really sort of what's next for us. Making sure that we have the acoustic platform up to snuff to work with the materials that you want, so it's both accurate in position, so that you can do chemistry. That the instrument is safe to use. Joe's been doing some work. Probably we'll be able to use the FPA class 3s. We don't think the class 4s will work, but we also don't think they'll work chemistry because they basically evaporate too fast for reactions to occur. And then, of course, I think we'll talk a bit later about the mass spec loading. So very briefly on the acoustic side, so that Ed doesn't have to drag you through the details. This is pretty much the same kind of process that we used before, but instead of making a 2.5 nanoliter drop, making a mound and following through with acoustic power to have the drop come out, we make a mound and then basically we blow it up. And that's how we can generate a mist that's very much like KSI. But again, we don't have to touch it, and that's how we get speed. And so we can get all these fluids with the tools that you heard about before, like DFA, to essentially jump up and show you and create a little mist from lots of different aqueous properties. Was my first analysis. Since that time, again, just like previously, we wanted to make sure that it also worked end to end. So we closed the loop on a couple of solvents to make sure that not only can we make them acoustically, which turning out to be pretty easy, but to make sure that we can figure out ways to make the system work as a whole so that we can get good signal out of the mass spec. So we've done it quite a bit with different aqueous properties. A lot of that work's been done at AstraZeneca. We've also qualified some other reagent materials, including DMSO itself. So going back to our roots, we've been able to show actually AstraZeneca did this work independently, that they could actually do analysis straight out of compound libraries. Just take DMSO libraries, shoot them right into the instrument. Again, it's similar with acetonitrile and most recently ethanol water. So we don't think that other things won't work. There's just systems integration issues on parameter optimizations to get them there. So very quickly, the results are quite clean with the MSO. You can see peaks quite cleanly from sample libraries. Again, no processing, usually shooting about 10 nanoliters and they'll show up. So again, the big advantage is speed. We now have something where we can do analytical loadings from DMSO. We can run at 100,000 per day. We we've already demonstrated through the first revolution that we could actually move hundreds of thousands of different materials per day. So if you have small numbers of components in your multi-component reactions, you can do the math and see we're closer to parity and making things very, very quickly. So just to wrap up, revolution, more than just miniaturization. We need input from you, as we had from our customers previously, to figure out what are those new workflows, because you're going to come up with them. I'm not. You're going to tell me about them. We're going to make machines better to meet your needs. But small, and how small will help you do things that might change the way that you want to do things. If you have more rapid diffusion times, things are smaller. There's larger surface areas, right? So you're probably not going to have to worry as much about heat transfer because you have a small amount of volume and a large amount of surface area to pull it out. Generally, we see from the small amounts of material, surface tension-driven flows can homogenize things quite quickly. And also something that I don't have time to talk about, which I have to talk about offline, is that you can actually use miscible fluids to separate materials but still have contact interface. So last slide, I think we're now ready to take chemical synthesis into the 21st century. One thing Nicholas Flamel did not have in his work was an echo. So really start thinking outside the flask, start thinking about, not inside the box, but think with our box. What can you do with a new tool to really power things? Tell us about it, make sure that it works. We may not be able to do it right away, but we get to almost everything eventually. And thank you for a couple of extra minutes, because I just got too excited. I've been waiting for this day for 10 years. So thank you for your patience.
We are a little bit under time pressure, but if you have meanwhile some questions,
Or catch me afterwards.
or you catch him afterwards.
Good morning, ladies and gentlemen. Welcome to my presentation. In the next 20 minutes, I'm going to present you the acoustic displacing chemistry, which we are doing now in our lab. Our team in our lab, which is working in acoustic dispensing chemistry, consists of 2 postdocs, 3 PhDs, 1 technician, and 1 programmer. And we have ECHO 555 in our lab since mid of December 2017. It's in a dedicated lab, and it has a dedicated fume hood. And of course, we are planning to do isocyanide-based multi-component reactions with this machine. And isocyanides are ready, so we need to have these fume hoods. And in near future, hopefully, after if we get the grant, we will have a fully dedicated lab with more than 200 square meter, ample hood area, and centralized working bench for our ECHO. And the questions which we are going to answer was that we wanted to expand the ECHO-approved solvents to other useful solvents for synthetic chemistry. ECHO-approved solvents are water and DMSO, and we expanded this to the useful solvents which we needed for our synthesis. And we showed the reproducibility of the volume suspension. What is the best volume for the reactions? What is the smallest volume possible for the reactions? And we will show the pilot scale down of some multi-component reactions. And also we will show some complex few step procedures for our synthesis. And at the end, of course, we have to do some analytical investigations of the reactions which we have done in the plates. In this table, you see the properties of water and DMSO, eco-approved solvents, and the rest are organic solvents, which we planned to have them as solvents for our reactions. And our choice was ethylene glycol as the best solvent, since I will show you the reactions. Our reactions were done in methanol already, and methanol was the best solvent for this reaction, so we need protic solvent for our reactions. But of course methanol is not good for acoustic dispensing machine because it's very volatile. So we chose ethylene glycol, which is protic and it has a good vapor pressure and it's not flammable. In this slide, I want to show you the reproducibility of the reactions at different volumes. This is a GBB reaction, which I run on 20th of January. This is 21st of January. This year, the total volume transferred to each well was 2,100 nanoliter, and here was 4,650 nanoliter. And we use SFC to see how the reaction worked, to assess the reactions, and this is the UV, this is the total ion current, and this is the specific mass that we want to see, the extracted mass. And here you can see that it's really reproducible, and it shows clearly very good peak for the mass which we expected. And the molecular weight for this compound was 500, and I cannot see clearly something. And first, we plan to find out what is the smallest volume which we can transfer with this machine. So our reaction was 3 components. We transferred 100 nanoliter first for each component, but unfortunately, what we found at the solvent was ethylene glycol. And what we found was that each of the droplets went to one corner, so of course this is not good for chemistry because they cannot meet each other, so the reaction will not go on. So we increased the solvent, and finally the 3,000 nanoliter was a good volume to be transferred, and we got finally good results. The first thing that we needed to run the reactions was stock solutions of the starting materials. So we prepared a lot of starting materials with a concentration of 0.5 molar in ethylene glycol. It's also important to note that ethylene glycol was also a good solvent in regarding solubility. It could dissolve because when we are preparing the stock solutions, one problem is also solubility. But we could prepare 73 stock solution of isocyanates, 53 aldehydes, 34 cyclic amidines, 33 long chain amino acids, 74 carboxylic acids, and 16 amino isocyanates. But this is not all, and we are preparing more and more. And this is the vials which we used in the beginning, and now we move to this kind of vials, which are very good for our hard tube high throughput purpose, because easily by using multi-channel pipettes, we can transfer the starting materials from our stock solutions to plates. Another requirements which we needed was some software developments. We already had RAND React program. With this program, if you have starting materials as the input, it could give us the products, randomly generated products, but we needed some development on this program. We needed some connectivity between the source plate and the destination plate. And for this purpose, Nicolo, our programmer, helped us to develop our RAND React. And with this program, now we have the input of the starting materials. With the, here we can see the starting materials, amidines, and this is the location of the starting material in the plate. So for a 3-component reaction, we have the input of 3 starting materials with its location to our RAND React, and then this program can generate randomly the products, and it gives us the products with the place of the starting materials. The three first location are the location of the starting material, and the first location is the location of the product in the destination plate, and it's very helpful for us. And it's also important to mention that, of course, for us it's necessary to have a randomly generated library, because combinatorial library is not good for us, because I will show you next slide that with this library of starting materials we can have thousands of products. So we need a randomly generated library to cover everything. And this is this output that we get from this program is easily convertible to the pick list, which we can immediately have as an input to Echo Machine, and we can simply run it. And in this program, here we have the place of the starting materials in the source plate, place of products in the destination plate. The smalls, the molecular weight, the structure is the output that we can get from this program. The first reaction which we ran with Echo was a GBB reaction. GBB reaction, here you can see the general scheme of this reaction is a three-component reaction of isocyanide, aldehyde, and cyclic amidines, and it gives us this cyclic scaffold. This cyclic scaffold is very important, and it has diverse medicinal applications. For example, in FXR, HSP70, and autotaxin receptor antagonists. And here you can see FXR protein with a GBB compound inside, which is published by co-crystallized and published by Roche. And the specific thing about GBB reaction is that there are more than 20 catalysts reported for this reaction, and but the best catalyst is scandium trifluoride, and the best solvent for this reaction is methanol. So what we needed to do was to optimize this reaction for the Echo Machine. And so we started with, we selected scandium trifluoride as the catalyst, and we started the solvent optimization. And we chose the MSO standard solvent for the Echo, and is a propyl alcohol and ethylene glycol. And here you can see this is the SFC of the crude mixture which we run, and you can see clearly very good peak UV and mass for our product. And this is the TLC of the reaction mixture. Actually, this reaction works very well with 90% yield, and the major peak is our product. So we chose ethylene glycol as the solvent, and we prepared our source plates. Here you can see the 53-aldehydes, this is our amidines, this is 73-isocyanide, and this is the well for scandium trifluoride as the catalyst of this reaction. And here I want again to mention that by using these starting materials, in principle, we can have more than 131,000 compounds. So it's really necessary and important to have a randomly generated library for the product formation, and it's not possible to do it by combinatorial. And this is a simulation of the pick list that with this pick list we run this GBB reaction, and this is the source plate, and this is the destination plate, and here you can see that according to the pick list the wells are filling. Yes, these are the three components which are added, and at the end the catalyst will be added. And this is for the three-component GBB reaction for 384 well plates. And this is the catalyst which at the end is being added. And this is a picture of our destination plate. What we transferred was 1 microliter for each starting material, and 100 nanoliter of catalyst is 10% catalyst. And since it took, we are transferring large amount of solvent, because this machine is 4 nanoliter. It took 2.5 hours. And in the next step, we did the quality control for our plate, and we did this by SFC. And based on the peak which we could see in SFC, the intensity of the UV and the selected mass, extracted mass, we divided our plate into 3 colors. The green was the one that was showing a really good peak in UV and extracted mass, that it clearly shows our product form, and the yellow one was the one that it shows the product, but it was just formed and it was not really a major peak. And the red one was the one that we couldn't find the product inside. And we have 28 green, 16 yellow, and 30 red wells. This is one selected well, which we could find it as a green. This is the structure. And first, because we wanted to be so fast, first we run a 2-minute run with SFC just to see if we can find anything or not. For example, for this compound, we could see a good UV, and this is important for us that we could see a good peak for extracted mass at the molecular weight +1. Here we could find the mass with a good intensity. So next step was that we run a full run SFC through the column, and with a 7-minute run, here you can see the separation, and it shows a good intensity in UV for the product, and here is the mass. So we consider this well as green. And for the wells which it was green, this is what we could see, and we didn't find any peak here at extracted mass, so it means that this is also a 2-minute run. It means that we consider this as no product inside. In Dumling Group's lab, since 2 years, we are working on many MLL protein-protein interaction, and we already had active compound as inhibitor for this protein-protein interaction. And so we said we planned to have a plate with this compound inside to see if our biologists at Group's lab can find our active compound. And this was successful, and here you can see with from the plate, out of 31 wells, the black one, which shows the shift, is our active compound, and they could easily find it. The next project which we run with ECHO was a macrocyclization reaction. This is a very diverse and two-step synthesis of the macrocycles, which is already published by our group recently in Annual Chemistry. So we plan to run this reaction by ECHO. This reaction was reported in methanol and in high dilution at room temperature. So what we did was that we prepared again the source plate for this reaction, 33 long chain amino acid, 53 aldehyde, 73 isocyanide, and we used ethylene glycol as the solvent. Before running the plate, again we optimize the solvent and we run this reaction in the flask for ethylene glycol, and the reactions worked well. Then we prepare the stock solution and we run it in the ECHO. And here you can see that, again, by using this number of starting materials, we can have more than 127,000 compounds. This is a structure of the amino acid building blocks which we have in solution, and we use them in ECHO. But in our lab, we have more than 200 shelved amino acids, and our plan is to use more and more of these building blocks. And this building block is can be easily synthesized via a two-component reaction. And this is the destination plate for our macrocycle run with ECHO. And because for microcycle we needed high dilution, our total volume is 5 microliter. We transferred 100 nanoliter of each starting material, and then it was dilution by the solvent, ethylene glycol. And because the large amount of solvents are being transferred, the run was very long, 4 hours and 15 minutes. But our plan in the next step is that we just transfer the reagents by echo, and we will buy another machine which can much faster transfer the solvents to each well for dilution. And this is an example of one well of microcycle reaction, which it shows the product. And this well, quality control for this plate is ongoing. And this is a molecular weight. And we plan to have microcycles because similar to many MLL, we have an active compound for IL-17 project, and similar to many, again, we could find our active compound, BMST, in our plate. And the screening projects which we are planning to do is to run a full plate of GBB to screen it for many MLL protein potentiation by DSF, to have a plate of microcycles for IL-17 receptor to screen it by DSF and MST, and to have a plate of covalent libraries for phosphatases, and assess it by chronometric assays, and a plate of covalent libraries for USP2 protein interaction, and to assess it by DSF. And this is our future plan. This is our future plan to synthesize these two macrocycles. And this is again a very easy synthesize, three-component reaction for UGI tetrazole and classical UGI reaction. For these reactions, we already have stock solutions prepared. We will use for the first one 16 amino isocyanide and 53 aldehydes, and for the second one we will use 16 amino isocyanides, 53 aldehydes, and 74 carboxylic acids. And our next future project is to synthesize these sheet bases via interrupted Fischer-Indel synthesize as a starting material. And this building block is a challenge because we have to synthesize it and it is not commercially available. And we are going to synthesize this compound in gram scale in a parallel synthesis. And these are the reactions which we are planning to do by this sheet phase with echo. Is the first one, this is the UGI reaction, UGI tetrazole reaction, and hydrogen synthesis. And for this reaction also, same as always, we started with solvent optimization because ethylene glycol is not a standard solvent for these kind of reactions. And so we use ethylene glycol and room temperature for all of the three reactions, and it works very good. And here you can see the SFC of hydrogen synthesis for which shows clearly the molecular weight, expected molecular weight. And in Fischer-Indel synthesis also, if you go in the literature, there is a long procedure to synthesize and to purify it. And what we did was that after the reaction was done in DCM, just by simple filtration through silicon extraction by sodium bicarbonate, we could have more than 90% pure compound. So by this simple purification method, we are able to parallel synthesize 24 well plates, and it's a scalable to 1 gram, and the average purity more than 90%. And we are planning in near future to have more than hundreds of these building blocks. And here you can see the NMR after purification of these compounds, which is very pure and nice. And of course, we are thinking about more development in our software. We want to have full flexibility in plate occupation. We can see the plate, and we can see what is inside the plate. and implementation of genetic algorithm. And for this purpose, we will have Nicolo in our lab as a PhD student and as a programmer for this project. And this is our team, which helped me to have these nice results. And this is Nicola, our programmer, Trifonos, Rishu, Mariam, and Lee. Thank you to all, and thank you for your attention. I'm here if there is any questions.
So very technical presentations, I'm pretty sure. I mean, these are very, very preliminary results. Basically, we only had the echo since 2 or 3 weeks now, and I think it's quite amazing what we accomplished in this short time. And there is certainly massive room for improvement, and but meanwhile, there are for sure some questions from the chemists in the room. Yes, please.
So you have this potential to make hundreds of thousands of compounds, but how do you choose which ones are going to be your 1556?
We are using, I just have the starting materials as input, and this random react software will give me the product, and I will just take that.
It's random.
Yes, I can, and with this program, I can tell this program how many products I want. So I will tell him that I want 384 products in a 384 well plate. So, and then it will just give me 384 randomly.
For the genetic algorithm-driven drug discovery, it needs random libraries for the first generation 0, and afterwards, of course, it's determined by genetic algorithm what is the next generation based on the screening results. But in the future, there will be also an input, for example, that you want to stay in the rule of 5 or this, and so there will be software which allows to guide the synthesis in the right chemical space, whatever the right chemical space is.
Maybe I can ask a very quick technical question. You showed that about, say, 40% of your reactions in one example did not work and did not give the product. Do you know if this product was formed, would you do it classically without the echo, or do you just not know?
Some of them will not, I'm not sure if they really, I mean, I didn't try them because, for example, exactly the example which I showed here, which was red, this structure, this amidine, which is used in this reaction, is not a very common amidine, and I don't know if really you do it in a gram scale, it will work or not. I didn't try. Because if I have, two aminopridines, primidines, they are known starting materials for GBB reaction. But this one was a bit a strange one, but we wanted to have it in our plate because I thought it's nice if we can even find some chemistries which you don't expect it to work, but maybe it works.
In this particular case, since we are doing really random chemistry and there is no cheating at all, whereas in chemical literature very often people take combinations of starting material, they know they work, like for example in most of the isocyanide-based multi-component reaction chemistry, people prefer to take test-butyl isocyanide, not only because it's commercially available, but also because it's highly electron-rich and therefore very reactive. And this is really a real-life example where we took randomly all the isocyanides we have in the lab, and from this plate, less than 5% have been described in literature previously. So this is a case which is totally new, and of course it can be optimized. And, we will try different types of combinations of solvents and catalysts in the future. Again, this is extremely preliminary data.
Have you also thought about less volatile alternatives to chlorinated solvents?
No. In these 2 weeks, we just used ethylene glycol. Maybe it can be our next plan, but with ECHO, there are some limitations also, so I'm not sure that.
So how difficult is it to calibrate the machine for completely new solvents?
This is not what we are doing. We already asked even for calibration for ethylene glycol because ethylene glycol also is not their standard solvent, and Dominic told us that it takes longer than what we expect. So Yeah.
Because
We are using ethylene glycol with normal CP calibration.
Well, I think it's important, super important to be able to handle other solvents, right?
Yeah, I can probably, if I can answer that one. So for the most part, the Echo will transfer the solvents. Generally, what we hadn't optimized for, because it wasn't a requirement previously, was to make all the drops land in the same spot.
Yeah.
So they haven't been designed to optimize that, and that's, as I mentioned before, sort of the work that we need to do is to make sure that not only are they volumetrically accurate, but the placement is correct. So for some solvents, we did validate that, but we didn't have sort of chemical solvents in mind. So things like glycerol, which is used by screeners, or things for crystallography, that works pretty well. Drop-on-drop for crystallography solvents.
But for example, the ethylene glycol, I think that's suitable for super reactive chemistries like granules, etc. So that would be interesting.
But I think for the future, that is something that we'll want to work on, and we'll give those to do as we roll them out. We'll have dominate them out and upgrade your machine to make it a bit smarter.
It will be very helpful because then hopefully we can go to a really nanometer scale. This is what I am a bit suffering now.
So what do you think is the purity threshold for reliable biological activity testing?
We already tried, as I said, our active compound for meninMNL and they could find it. So at least for 2 reactions that we tried, the purity was good enough that they could again find it.
Okay. And maybe second question regarding the success rate. Do you need a minimum success rate that your algorithm later on does work reliably?
Well, there is always the step of quality control in between. So before they will be going to the screening, we will know if the compound is there or not. And I think we will take the green and the yellow ones, and they should give reliable results. And the other ones simply did not work, so then they are excluded from the algorithm. So there is a mechanism how you can exclude red wells where there is no product information, and this will be taken into account in the genetic algorithm.
So the quality control is done by MS, is that correct?
Agency MS?
Yeah. I mean, it can be somewhat misleading because oftentimes you get other products than you expect. I'm also wondering about how do you deal with excess of starting materials that have not reacted in when you submit it to the biological assays, like isocyanates. I mean, definitely will be a reactive component that will give you completely different results. So how do you envision
So we envision that we, of course, have the starting materials as well plated, and then if you see a very strong overlap of wells where there is a lot of starting material left with the blank, with the reference starting material, then this can be also taken into account. So far, despite the fact that we had definitely starting materials left in all of the wells, so this is for sure, and the biology was tolerative to this kind of experiments, but we were running IL-17 and medium so far.
And one practical question. So how smelly was it working in these small volumes?
In the beginning, this fume hood was not connected to the box, and when I was sitting there, it was really smelly. But when we had the fume hood connected, so next time I just asked our technician that please ask someone to connect it, and when it was connected, it was really out without any smell. I don't know, it's the power of the fume hood.